Calf pain is a common complaint that many people experience at some point in their lives. It refers to discomfort or pain in the back portion of the lower leg, specifically in the area between the knee and ankle. This region is primarily composed of the gastrocnemius and soleus muscles, which together form what we commonly call the calf muscle. These muscles play a crucial role in our ability to walk, run, jump, and maintain balance. Calf pain can manifest in several ways. It might feel like a dull ache, a sharp stabbing sensation, or a feeling of tightness or cramping. The pain can be localized to a specific area of the calf or spread throughout the entire muscle. Some people might feel a sudden, intense pain as if they'd been struck in the back of the leg. Others might experience a gradual onset of pain that worsens over time. Let's now explore some of the most common causes and how they typically feel like. Causes of calf pain. Calf pain can stem from a wide variety of causes, ranging from simple muscle fatigue to more serious medical conditions. Number 1. Muscle strain or tear. Strains occur when the muscle fibers are stretched beyond their capacity. This can happen during activities that involve sudden starts and stops or heavy lifting. A muscle strain often causes a sudden, sharp pain in the calf. You might hear or feel a pop at the time of injury. The pain typically intensifies when you try to use the affected muscle, such as when walking or standing on your toes. Swelling, bruising, and muscle weakness may also occur. Number 2. Muscle cramps. A cramp is an involuntary contraction of the muscle that can last from a few seconds to several minutes. The pain is usually sudden and intense, often described as a severe squeezing or knotting sensation in the calf. Cramps can occur during exercise, especially in hot conditions or when dehydrated, but they can also happen at rest, sometimes waking people from sleep. Number 3. Exercise-induced muscle soreness. Engaging in new or intense physical activities can lead to delayed onset muscle soreness in the calves. Unlike acute injuries, muscle soreness typically sets in 24 to 48 hours after exercise. It causes a dull, aching pain that's often accompanied by stiffness. The pain usually improves with gentle movement and resolves within a few days. Number 4. Peripheral artery disease. PAD occurs when there's a narrowing of the arteries that supply blood to the legs. The classic symptom of PAD is claudication, which is pain or cramping in the calf that occurs during walking or exercise and is relieved by rest, but returns when activity resumes. This pain is often described as a tight, aching, or burning sensation that develops gradually during activity and subsides within a few minutes of rest. The pain may be accompanied also by a feeling of coldness in the lower leg. Number 5. Deep vein thrombosis. Deep vein thrombosis is a more serious cause of calf pain that requires immediate medical attention. DVT occurs when a blood clot forms in one of the deep veins of the leg. It can cause a persistent, aching pain or tenderness in the calf. The pain may worsen when you walk or flex your foot upward. Other symptoms can include swelling, warmth, and redness in the affected area. It's crucial to note that some people with DVT may not experience any symptoms. Number 6. Achilles tendonitis. While not strictly a calf muscle problem, it can still cause pain that extends into the lower part of the calf. This condition involves inflammation of the Achilles tendon, which connects the calf muscles to the heel bone. The pain is typically felt just above the heel, but can radiate up into the calf. It often starts as a mild ache that worsens with activity, especially running or climbing stairs. Number 7. Sciatica. Sciatica is a compression or irritation of the sciatic nerve. This can cause pain that radiates down the leg into the calf. Sciatic pain often starts in the lower back or buttock and extends down the back of the thigh into the calf. In the calf, it might feel like a shooting or burning pain, sometimes accompanied by tingling or numbness. Number 8. Compartment syndrome. This serious condition occurs when pressure within the muscles builds to dangerous levels, interfering with blood flow. Compartment syndrome causes intense, continuous pain that doesn't improve with rest. The affected calf may feel tight, full, or hard to the touch. In severe cases, numbness or paralysis can occur. Acute compartment syndrome is a medical emergency requiring immediate treatment. Number 9. Diabetic neuropathy. People with diabetes can develop nerve damage called neuropathy that often affects the legs and feet. Diabetic neuropathy can cause various sensations in the calves, including burning pain, tingling, or numbness. Some people describe it as feeling like they're wearing an invisible sock. The pain may also worsen at night. Number 10. Varicose veins. While often considered a cosmetic issue, varicose veins can sometimes cause discomfort in the legs. Varicose veins can cause a heavy aching sensation in the calves, especially after standing for long periods. You might also experience swelling, throbbing, or a feeling of restlessness in your legs. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. When should you talk to a doctor? Here are some red flags that indicate it's time to talk to a doctor. Number 1. Sudden, severe pain. If you experience sudden, severe pain in your calf, especially if it is accompanied by swelling, warmth, and redness, seek medical attention immediately. This could be a sign of a deep vein thrombosis, which requires prompt treatment to prevent complications. Number 2. Pain with swelling and changes in skin color. Swelling in one or both legs, along with changes in skin color, redness, bluish tint, can indicate a serious condition such as DVT or an infection. Number 3. Calf pain that occurs after a recent long period of immobility, such as a long flight or bed rest, should be checked out as this increases the risk of DVT. Number 4. If you have calf pain that occurs consistently when you walk but is relieved by rest, especially if you're over 50 or have risk factors for cardiovascular disease, you should discuss this with your doctor. This pattern of pain could be a sign of peripheral artery disease. Number 5. If you have a history of blood clots or clotting disorders and experience new or unusual calf pain, you should consult your doctor. Number 6. Persistent or worsening pain. If your calf pain is persistent or worsening over time and does not improve with rest, ice, or over-the-counter pain relievers, it's important to see a doctor. Number 7. Pain with fever. Calf pain accompanied by fever can be a sign of an infection, such as cellulitis, that requires prompt medical treatment. Home treatments for calf pain. If you have mild calf pain, there are several home treatments you can try to alleviate discomfort. Start by resting the affected leg and avoiding activities that may exacerbate the pain. Applying an ice pack to the calf for 15 to 20 minutes every few hours can help reduce inflammation and numb the area. Elevate your leg above heart level when resting to decrease swelling. Gentle stretching and massage can also provide relief by loosening tight muscles and improving blood flow. Over-the-counter pain relievers such as ibuprofen or acetaminophen can help manage pain and reduce inflammation. Staying hydrated and maintaining a balanced diet rich in potassium, magnesium, and calcium can also prevent muscle cramps. If your symptoms persist or worsen despite these measures, it's important to seek medical advice. Now, we want to hear from you. Do you or someone you know have calf pain? What was the cause of it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.